So today we'll be doing injection administration. And so the first thing you want to do is read your physician's orders, compare them to what is in the medication record. Make sure you have the right patient. We have Jack Buzzard, MRN 87134651, date of birth 6/20/1998. And we have the correct patient indeed. So now the doctor ordered excuse me, 1 gram of ceftriaxone IM Q 12 hours for infection. Reconstitute in 2.5 mLs of sterile water, and that matches with what is in the medication record. Next up, we have PPD 0.1 mLs intradermally today. Read in 48 to 72 hours. That matches as well with what is in the record. Lastly, we have NPH insulin 12 units sub-Q before breakfast, as well as sliding scale regular insulin sub-Q AC and HC. And that is also in the medication record, all for 700 hours. Okay, so now that we know that the physician's orders matches with the patient's plan of care or their medication record, I will be just reading from the medication record and set these orders aside. These are the physician's orders. I'm going to set those aside, and we're going to be reading off the medication record now. So now that I know what I need, I'm going to go to the medication room, and in the room I'm going to wash my hands, do my hand hygiene for 30 seconds, make sure that the area that I'm going to be preparing my meds on is clean, and then start pulling my meds. So as I pull my meds from the Pyxis, I'll be doing my first medication check, which is where we check for the 6 rights. We check for right patient, right medication, right route, right dose, right time, and proper documentation at the end. So first medication check is for ceftriaxone 1 gram. Is this for Jack Buzzard? Yes, it is. Okay. Then we have our PPD. Okay. For Jack Buzzard. And for this demonstration, I'll be using the sterile water as the tuberculin or PPD because I don't have any available, but I will also use the sterile water as sterile water. Next, we have NPH insulin for Jack Buzzard, that's right, and regular insulin for Jack Buzzard at 700. Okay, so our first check is done. We have all the right meds. The next thing we're going to do is prepare them. So for preparing them, since I already did my hand hygiene, I'm just going to put on some gloves to be sure, or be safe, I mean. And as I prepare my meds, I'll be doing a second medication check as well. Also, what I want to do is grab my drug book and make sure everything is within normal parameters. So let's see, first up we have ceftriaxone. Ceftriaxone inhibits bacterial cell wall synthesis. So it's an antibiotic. It says for adults, normal dose is 1 to 2 grams per day, maximum of 4 grams in 24 hours. And the doctor ordered 1 gram every 12 hours. So that's within normal limits. It is administered IM, of course. So everything is good with that. For tuberculin, unfortunately, it's not in this drug book, but I would inform the patient that tuberculin is simply a test done for, or to see if patients have been exposed to TB, if patients have been exposed to TB And so all it is a bleb injected in the forearm, and it would have to be read 2 to 3 days afterwards. Any side effects that come with that are just, it could be irritation or itching, but advise them not to scratch or, pull or tug at, mess with it. Just don't mess with it, or it could affect the test results. And so for our insulin, let's see, we have our insulin right here. And some side effects of ceftriaxone are headache, dizziness, nausea, vomiting, diarrhea, rash, dermatitis, just to name a few. And for insulin, it says the route for regular is sub-Q, give half an hour to an hour before meals. Okay. So everything is within, everything was ordered within normal parameters. So that's good on that end. So we're going to prepare our medications now. The first one we're going to prepare is our ceftriaxone. Now, you'll have to excuse me because I accidentally blocked the safety on the only needle I have, but I will verbalize what I am doing. So, for our ceftriaxone, we're going to do our second check as we prepare it. Second medication check. This is indeed ceftriaxone, 1 gram for Jack Buzzard. And I'm going to reconstitute with the 2.5 mLs of sterile water. So you're going to want to grab your vials, pop the tops off, grab an alcohol wipe, and wipe the tops of the vials. Dispose of that. And then we're going to grab a 3 ml syringe and a 23 gauge needle. And so we're going to open our syringe, open our needle, assuming that this is a new needle, and attach that. And then you would draw up, since we're getting 2.5 mLs of water, we're drawing up 2.5 mLs of air. And so I have my 2.5 mLs of air, and then I would just inject it. Unfortunately, if you can see, I can't inject it because I put the safety on, like I said. But you would inject the air into the vial of the sterile water. And once you have injected the 2.5 mLs of air into the sterile water, you simply draw back out 2.5 mLs of sterile water. And so, assuming that we have our 2.5, just right here, mLs of sterile water, we are going to inject the sterile water into our ceftriaxone. So we inject our 2.5 mLs of sterile water into ceftriaxone, and then you remove the needle, and you could put the safety on immediately after and dispose of it, but get a new needle. But if you don't have a needle, then you could recap this using the scoop method. So with the scoop method, you simply push the cap up against something hard and then scoop it up, and once you know it's on, you just firmly put it back into place. Either way, you're going to need to draw the ceftriaxone up again. So, once you got that in, you want to mix it, but don't shake it. If you shake it, you'll get air bubbles in here. You can just roll it gently. Make sure all the powder mixes with the water. Once it's mixed, Once it's mixed, we're going to go ahead and draw up our 2.5 mLs because that's what equals a gram and that's what is ordered. So you get 2.5 mLs of air, and then you inject your 2.5 mLs of air. Then you slowly and carefully pull back out 2.5 mLs of ceftriaxone, which, as you can see, I've already practiced with this, so it's empty, but it's basically almost the whole thing. You want to make sure you get all of it because it's an antibiotic, so it's important. So then we have our 2.5 mLs of ceftriaxone. And of course, you would immediately put the safety on or put the cap on and dispose of the needle because it is imperative that when you give this to the patient, you have to give it to them using a fresh needle, not the needle you prepared it with, but a fresh new needle. So in this case, since I'm in the medication room, I'm just gonna recap it for now, and then I'm gonna grab a new needle to take with me into the room, and I'm gonna label it since I'm still taking it to the room. And this I would just dispose of properly. Next up, we're going to draw up our PPD. So second medication check for PPD. This is indeed PPD, and I will be drawing up 0.1 mLs. This is for Jack Buzzard. I'm going to grab my TB syringe. I'm going to pop the top off of this as well. Make sure you clean that off with an alcohol wipe. Take out your syringe. You draw up 0.1 mLs of air. Take the cap off. Inject your 0.1 mLs of air. And then pull back out the 0.1 mLs of PPD. Alright. Once you've made sure you have it, you're going to recap it by using the scoop method against something hard. Once you got it, cap it. And of course, you would label that too, or anything you take with you. Put that where it belongs. Next up, we're going to prepare our insulin. So for insulin, and this is our third check for insulin, second check for insulin as well. This is indeed NPH. We got regular. It's for Jack Buzzard. And it looks like since his lab values say that since his lab values say that his sugar was 389, then according to the sliding scale, we must draw up 12 units of sliding scale regular insulin. So it'll be 12 of NPH, 12 of regular. And of course, you take the tops off of your vials. Make sure you wipe them. And then you're going to draw up 12 units of air. And you're going to inject 12 units of air into NPH and then 12 units of air into regular. And then draw 12 units from regular and draw 12 units of insulin from NPH. So NR to RN. Okay, so once that alcohol is dry, we take the cap off. I'm going to inject my 12 units of air. And then inject 12 more units of air now into the regular. And now draw up 12 units of the regular. And as I draw it up, once I have the 12, you have to show a second nurse, hey, can you say that these are 12 units? So a second nurse has to check that you indeed have pulled up 12 units. So you have your 12 units, and then immediately draw up your 12 units of NPH now. And of course, you have to show, again, a second nurse that you are drawing up 12 units of NPH now. So we have a total of 24 units now. And then you immediately cap that using the scoop method. Okay. So we've done our second check for all our meds now. We prepared our meds. So now we're gonna walk over to the room where we will do our third check, put a new needle on this syringe that's containing the ceftriaxone, and administer the injections. So I would walk over to the patient's room, and of course, before I leave the medication room, I would take off my gloves, wash my hands, and I would knock on the patient's room, do my hand hygiene again for another 30 seconds, put on some gloves, and introduce myself. I would say, "Hello, Mr. Buzzard. My name is Chris. I'll be your nurse. But can you confirm your full name and your date of birth, just so you complete your 2 patient identifiers?" So he says, "My name is Jack Buzzard, and my birthday is 6/20/1998. That's great. So I have the right patient. So I would explain to the patient, and also I will move the curtain for privacy and raise up the bed to an appropriate height and let down the rail on the side that I'll be working. And I would explain the procedure. So I would say, so Mr. Buzzard, like I said, I'm here to give you your 7 a.m. injections. And what I have for you here is ceftriaxone, which is your antibiotic. And then I have your insulin, which I'll be giving you now that I see that you have your breakfast tray just got here. And it's important because you want to make sure that that breakfast tray is in the room, when you're going to give the insulin. If not, don't give it because you don't know if they're going to eat. So lastly, I also have this tuberculin or PPD that I'm going to give you, and it's simply done to see if you have been exposed to TB. Any questions? If it doesn't have any questions, then I will proceed to do my third check. And so, as I do my third check, I'm making sure that, okay, we have ceftriaxone 1 gram, which comes out to 2.5 mLs when reconstituted. So we have that here. This is for Jack Buzzard. That's good. We have our 12 of NPH insulin and 12 units of regular insulin for Jack Buzzard. Okay, third check there. And 0.1 mLs of the PPD for Mr. Jack Buzzard. So third checks for all our meds are clear. Now we're going to administer them. So for the administration part, what you want to do is you go in the order of least painful to most painful, because if you start with most painful, they're probably not going to want to keep on going. So we're going to start with the PPD, or the intradermal one. What you want to do is you're going to go at a slight angle, just a little more than the surface level, just so you can create this bleb. So the way we will do that is you will grab your alcohol wipe. You will give this on the forearm. Wipe the area, let it dry. Once it's dry, take the cap off. And then just go in at a very slight angle, just enough for you to be able to see that bleb at the surface as you inject it. And then you get your bleb and just pull it out. Immediately activate the safety, dispose of this in the sharps container. And you won't be able to see the bleb because this is plastic, but you would see a bleb form right under the skin. But that's what you would do for the TB or PPD. Now for the insulin, The insulin is sub-Q, and of course you wipe once again wherever the injection site is going to be. Wipe it with the alcohol pad, let it dry. That is given usually in the fatty parts, such as behind the arms or on the belly. Just make sure you rotate the sites so you don't cause any injury or bruising, associated with multiple injections. So you wipe once the area is clean. Rule of thumb is if you cannot pinch an inch, you go in at a 45-degree angle. If you can pinch an inch of fat, you go in at a 90-degree angle. So we're just gonna assume for this case that Mr. Buzzard has a bit of meat on him, thankfully. So I'm going to pinch an inch successfully. Remove the cap, pinch my inch, and just go straight down. Inject, and then take it up and activate the safety immediately. Dispose of it in the sharps container. Make sure after every injection if there's no bleeding. And then lastly we have our IM injection. Now IMs are best given in the vastus lateralis or also in the deltoid. So for the deltoid you find the acromion process, and then you go 2 to 3 inches below that and you would insert it at a 90-degree angle. And you would use the Z-track method, although that whenever you're at clinical, you do it per hospital policy. So for this demonstration, I will show the Z-track method, but I would first check the hospital policy, and if they don't specify, then I would use the Z-track method. So for the Z-track method, once again, after we get our alcohol pad and wipe the injection site, what you're going to do is you're going to have your syringe of ceftriaxone, and like I said in the medication room, you're going to put on a fresh new syringe, or needle, you're going to put on a fresh new needle for your patient. So once you have that fresh new needle on, you take the cap off, and then you're going to pull with your hand away, and then you're going to inject at a 90-degree angle slowly. And once you have given all of the medication, you lift up the needle and also your hand, and you immediately activate the safety, and you put this in the sharps container. And so using the Z-track method helps trap the liquid so it doesn't seep out after you take the needle out. And then afterwards, you see how well the patient is doing, if they tolerated that okay, or how they tolerated it. See if they're not bleeding or if they have any immediate reactions. If not, then lower the bed back down, put the rails back up, give them the call light, make sure it's within their reach. I would let them know, hey, I'll be back in 30 minutes, but if you need anything before then, let me know or hit the call light. And then I would go, of course, walk out, do my hand hygiene as I walk out, take off my gloves, do my hand hygiene for 30 seconds, and then go and do the 6th check, or the most important one is make sure you document everything you gave, to who, the time, etc. And that's pretty much it on the injections. And lastly, for an ampule, unfortunately I've already broken this one. It's the only one I have though. But when you open an ampule, what you want to do is make sure you have enough fluid, and you would simply grab an alcohol wipe, clean the ampule, and then grab the tip. There's a glass tip right here, and there's a line etched at the neck of it. So you wrap your alcohol pad around the neck, and you open it, snap it in half, but do this away from you, from the patient, from anybody else, so you don't get glass in their eye or anything. And you simply snap it and dispose of this in the sharps, and you would draw this up using a filtered needle. But yeah, that's about it.